The importance of a functional healthcare system in any nation cannot be overemphasized. In the words of former British Prime Minister Winston Churchill, healthy citizens are the greatest assets any country can have. However, the health of citizens is dependent on the quality of healthcare provided by the system in that country. Achieving an effective healthcare system that caters adequately for citizens, therefore, requires sufficient financing. Any country that seeks to achieve its national health goal of providing affordable healthcare for its citizens must have efficient methods of healthcare funding in place. In Nigeria, the healthcare sector is financed by a number of mechanisms, including tax revenue, out-of-pocket payments, donations or fundraising, and health insurance schemes. Unfortunately, these mechanisms have not been very successful in the past, and achieving a functional funding system has remained a challenge in the country. According to the World Health Organization, Nigeria ranks 187 out of 191 countries in health system efficiency with regards to health expenditure per capita. Nigeria's health funding system is faced with inadequate government investments, poor insurance coverage, and poor donor funding, resulting in extensive out-of-pocket payments for citizens. These challenges are further heightened by corruption and unstable economy. This exposes the poor to huge health spending, trapping them in poverty. As the global health community urges towards achieving the goals of universal health coverage and health equity by the year 2030, there is a pressing need for the Nigerian government as well as stakeholders to develop a better understanding of the challenges faced in the health sector and draw up a suitable plan to address the issues threatening public health care funding. To achieve universal health coverage, Nigeria must shift focus from out-of-pocket payments to other means of financing the healthcare system. Exploring and strengthening other tools for funding the health system will boost the sector immensely. In addition, healthcare funding needs to be informed by research to enable proper planning. Collection of reliable, relevant, and timely data for evidence-based planning and evaluating policies should be improved in Nigeria. Lastly, there is a need for proper implementation of the recently signed National Health Bill to ensure that everyone who requires healthcare services is able to access them and not denied due to inability to pay.